Hey guys, Dr. Alex here. In today's video, we're going to talk about stress, the most overlooked thing when it comes to headaches, to neck pain, to back pain, to spine pain, to pain in general. And we're going to talk about how it affects pain and the pain system in the body. We're going to talk about how it affects the spine, and we're going to talk about, in my office, how I talk about it with patients in terms of its effect on their health, specifically their spine health, but how it affects their health in general and what they can do about it. So I would say that one of the most important questions on our case review form is, what is the average stress level that you have faced over the last year? Now, especially since the start of the COVID pandemic, the answer for this question has typically gone up. Patients will rate from 0 to 10, and if they need a reference, I will say 10 is nuclear meltdown, or we could say global pandemic. 0, beach in Fiji, you got $1 billion in the bank, life is good. And so it's a really important question in our office, because right away it gives me a lot of important information about how much psychological stress might be contributing to physical changes in the body. So one of the things that patients hate hearing the most, not mine because I would never say this, is it's all in your head. And so what I think some doctors mean when they say this is that what's happening in your head is causing physical harm or physical change. And that's called psychosomatic. That means psychological stress results in physical stress or physical changes in the body. And so when we try to piece together somebody's case and figure out why they ended up in our office with the problems they have, we ask about physical stressors, we ask about nutrition or chemical stressors, and like I said, we ask about psychological or emotional stressors, because it's a huge important thing for why somebody might have a problem with their spine and why they have pain. And so a lot of people, they don't really understand why we ask it. They try to leave it blank, and I won't let them, because it's really quite important. And the reason is, we know that stress has a dramatic impact on our body. It is linked with almost every health problem there is, whether we're talking cancer, diabetes, heart disease, stroke, and of course, it's going to have an impact on your spine and your nervous system. So we're going to talk very briefly about how it affects the physiology of the body. It causes basically the fight or flight system, your adrenaline system, to kick in. This system, really useful if you're running away from a saber-toothed tiger. Not very good if the stress is because you have a mean boss, insert expletive potentially boss, that constantly causes, or some sort of life situation that constantly causes this adrenaline system to be turned on. You get a rise in cortisol, drop in testosterone, increase in blood sugar, a whole lot of other physiological changes that, if you're interested, you can look up. What's important to know is it slowly kills you, and when it comes to your spine, it's going to have similar effects on your spine in terms of detriments to health and your nervous system. But one thing you can think of as an immediate effect is, when you are stressed, when you have that fight or flight system, when someone scares you, what do? You tighten up. Muscles in the body get tight, shifts your spine forward, you bring everything collapse in trying to protect yourself. You start breathing with your neck muscles more than, say, your diaphragm. And if you have this going on for days, months, years, that tension around the spine, change in the breathing pattern, that shift forward in your poor posture, it's easy to see how that's going to yield some changes in your spine and some changes in the body. Namely, we see patients, when they circle greater than a 5 towards a 10, in general, they're going to be a little bit more stiff. In general, their spine's going to be more shifted forward. In general, they're going to have a lot more tension and shifting and problems at the base of the skull. And so when somebody tends to circle a higher number on that pain or that stress scale, I will automatically have to tack on a couple of checkups to their care plan, because I know that they're going to typically heal a little bit slower. I know that there's going to be a lot more collateral damage that we have to deal with as a consequence of what's happening in their spine or as a consequence of what's happening stress-wise. And in general, it just takes them a little bit longer to get better because we're working against more stress. We're pushing a little more against the freight train, trying to move it in the right direction. And if there's stress in somebody's life, it's really hard to overcome that initially. But, you know, with every case we take care of, as long as we can find that right balance, the results are good. And so with today's conversation so far, I've spoken really generally. I've used very simple lay language. If you look at the research and you look at chronic pain research, we know that there's a really strong connection between pain and stress, psychological stress. And we also know that there's a strong connection between pain, lack of sleep, and lack of sleep also goes along with stress. And so we know from the chronic pain and pain research that when somebody has stress, they are more likely to have a pain condition or to have chronic pain because of some of the aforementioned changes in their physiology that we already discussed. What I think is probably the easiest way to think about it is I talk about a magnifying glass with patients. And so when we talk about the magnifying glass, I'm talking about your brain's sensory system, your sensation system, and how it feels what's happening in the body. And there are certain things that are going to make you feel your body less or feel less pain. So, good nutrition and a lack of inflammation in the body, lots of sleep, a mindfulness practice, foam rolling, stretching, athletic ability, even things like happiness and outlook, they are going to shrink the magnifying glass so that if you have a problem or a boo-boo, your brain is going to be less likely to feel it or less likely to interpret it as pain. But, things like the opposite, things like lack of sleep, poor diet, not enough movement, psychological stress, what they do is they make that magnifying glass even bigger or stronger. So you and I could have the same boo-boo or the same problem, but if you have a stronger magnifying glass, you're going to be more likely to feel that issue, more likely for your brain to interpret that nociception, to interpret that boo-boo as painful. And when you start to get a really strong magnifying glass, it's also possible that you're going to go looking for pain or go looking for a problem subconsciously in your brain. And so reducing stress or being able to at least understand that one's pain can be connected to their stress level is super important. So I can think of GoPro's going crazy. So I can think of a patient that we're taking care of right now. And one of the things we discussed that's had an impact so far in her case is we talked about how the magnifying glass works. We talked about how in her case, her pain is disproportional to what I find in her spine, and that it's not that it's in her head, it's not that there's no problem. There's a problem, but she feels it much more than, say, I would or another patient. And so what we've taught her and what she's done a great job with is she's using some of the mindfulness skills she's already developed to make sure that when she feels that boo-boo, she makes sure that she directs the magnifying glass away from it so that she doesn't focus on it, so that she doesn't become obsessed with it, to make sure that we center her mindfulness away from the pain. And along those lines, as it comes back to stress, we were talking about things like stress reduction, we're talking about mindfulness, we're talking about getting better sleep, we're talking about improving her diet so that the magnifying glass in general is less strong. So if you guys are still watching, I appreciate it. I think this is one of the most important conversations I will ever have with a patient to make sure that they understand that what happens outside of the office, if they have a lot of stress, it impacts their health, it's going to impact their spine and their nervous system, and it's going to impact how they feel pain. And I think it's important because it gives people power, autonomy, and it makes sure that they have that understanding and that connection that when there's something going on in their life, if they get some pain, if they have more pain, if they get stiffness or tightness, if they get a big problem like they throw out their back, it makes sense. And I'll share from my experience that if I have a stressful period in my life, if something's going on with my family or something's going on with the practice, or there's a global pandemic and the office is closed for 4 months, I can almost guarantee that within a couple of days that my typical neck pain, right hand side, that started from a childhood hockey injury, it almost certainly comes back and I get a headache. I go to my chiropractor, he makes some corrections, it goes away. But I recognize that and can almost predict that when I have something stressful happen, I know that some pain that comes about or some problem that comes about, it doesn't reflect some new issue, it doesn't reflect something that's horribly wrong. It just reflects that there's been some psychological stress causing physical changes, and then those physical changes, you get symptoms. That's your body's way of telling you that there's a problem. Don't do whatever you did again, or else I'm gonna make you hurt. So, a really general discussion today. I hope you guys get some value from it. If you have any questions, please feel free to post them. If I were to, think about this conversation and move forward, I would think about how, we know that stress is bad for the body. Do what you can to either remove the stressors in your life or interpret it better. That strategies like mindfulness, better sleep, nutrition, having a healthy spine and nervous system, they're gonna help you reduce or interpret that stress better. And that knowing that when something is stressful, if you get some pain, if you have a problem, if there's a change in your body, it makes sense, it's normal. Make sure you get it corrected or fixed, and then deal with the stress in whatever way is healthy for you. So guys, thank you for watching. As always, I hope it's helpful. Take care, be safe, chat soon.